I'm Ali Sadeghi. I'm a plastic and reconstructive surgeon specializing in breast reconstruction. I think the most important part of my career in terms of reconstructive breast surgery has been that I can provide to women the care that they need in terms of both overcoming the diagnosis of breast cancer and restoring and re-achieving the goals that they have in terms of the aesthetics of their breasts. I think what's interesting with breast cancer is that when patients are diagnosed with breast cancer, they're overwhelmed with the diagnosis. It's a very emotional part of their lives, and when they're faced with that truth that they have to undergo therapy for breast cancer, there are a lot of questions, and there's sometimes a lot of confusion that comes into the picture. And they're discussing mastectomies, chemotherapy, radiation, reconstruction, and it can be very overwhelming. But the beauty of it is that I think at the end, when they realize that there is hope that they can be restored and their breast can be reconstructed to the natural breast that they have or enhanced to something better, I think that puts the icing on the cake where they're much happier with their treatment, and I think that's the most important part. Breast cancer diagnosis usually is made by screening mammographies, where patients have mammograms and some subtle findings are found, or suspicious findings are found, and they get referred to a breast center where a multidisciplinary approach is taken to the care of the patient, including radiologists, which biopsy the suspicious findings on the mammogram or the lumps that the patient may feel, and the pathologist gets involved and diagnoses the cancer. From there, they're referred to a breast surgeon or a breast specialist, which discusses the options in the surgical aspects of treatment of the breast cancer. And further, the medical oncologist and the radiation oncologist and the reconstructive surgeons finally come into the picture to get a multidisciplinary approach to the treatment of breast cancer. Breast cancer happens to be one of those diseases where, depending on the stage of the disease, the treatment is different. So not everybody gets the same treatment. And if one patient gets diagnosed and they have friends or family that have had breast cancer, everybody could have different treatments and different stories to tell. So the important part is, when you have a multidisciplinary approach to breast cancer, different doctors get involved at different stages of the disease, and some people may need a mastectomy and reconstruction, whereas others may just benefit from a lumpectomy and radiation, and that would be just as good enough as doing a mastectomy and reconstruction. So in the big picture, I think it's very important to have a multidisciplinary group of physicians taking care of the patient and to try to achieve and provide the best treatment options for the patient. So I think that one of the most important parts of having surgery in a facility that caters to patients that have breast cancer and undergo breast cancer surgery and reconstruction is that when they're going through this emotional journey of having their breasts removed and restored and reconstructed, that there's somebody there that cares for them 24/7, and that they're not just a patient in a hospital where nurses are forced to take care of multiple patients at the same time. This is a facility where you have one-to-one care from the nursing point of view to the patient. So it makes their care much easier, and their recovery a lot better, because their pain is addressed quicker. They don't have to wait a long time to get pain medications, and the post-op care is delivered much more efficiently. Patients are ambulating quicker, and they're able to get out of bed and walk faster. And this all makes a big difference in terms of the recovery phase of the surgery. In terms of the physician point of view, I think it's important that when patients go through this journey of breast cancer and reconstruction, that somebody's there to make sure that they understand what the patient's going through, and to keep them motivated and stay dedicated to the patient, to get them through the initial difficult phases of post-op recovery, and to kind of reflect on the future and reassure that everything's going to work out fine and they're going to look great. A little bit of background about breast reconstruction. Approximately 80 to 85% of breast reconstruction done in the country is implant-based, and we know that And not all women are candidates for implant-based reconstruction, and especially in patients that have radiation, implant reconstruction does not work well. Having said that, still, majority of women get implants in reconstruction, and the satisfaction and the longevity of reconstruction is not as good as when the patient's own body tissue is used for reconstruction. In advancing breast cancer reconstruction, several procedures such as the DIEP flap, the gap flap, and the PAP flap are used, and these are perforator flaps where we use patients' tissue without having to sacrifice any muscle function. And this is extremely important because after breast reconstructive surgery, you want the patient to recover quickly and gain function such as core strength and function of the muscles that they usually use. So it doesn't make sense to use any muscles and sacrificing any muscles for tissue to be used in breast reconstruction. Therefore, the DIEP flap is an abdominal-based procedure where both fat and the skin is removed along with some blood vessels. We don't sacrifice that muscle, which is very important in core strength and the daily movement. The PAP flap, which was pioneered here, uses the posterior thigh tissue, again without using any muscle tissue, and again we're using skin and fat and blood vessels, and the tissue can be removed and brought up to the chest wall, and the breast can be reconstructed by hooking up blood vessels and reestablishing circulation to the tissue. At the end of the day, when the breast cancer journey is coming to conclusion and the reconstruction is being finished, I think it's extremely important to get the patient back on the path where they were before being diagnosed with breast cancer, which is continuing with every activity and the daily activities of their lifestyle that they had. And it's important to not just physically and medically to treat the patient. It's also very important to address the emotional needs and to be able to restore their body to the existing shape, or even better by approaching it in a nutritional way, also with exercise and yoga and spa therapy to get them into the best shape that they can be in.